major groups of people and major regions to do a good job in COVID-19 control. The Joint Prevention and Control Mechanism of the State Council is hosting a conference on the epidemic control in key areas of low-risk areas in summer, and we have formulated relevant guidance covering the routine control, epidemic control in some key areas in low-risk regions in summer. So today's press conference is specifically about this particular field. And now let me introduce to you the guests we have here. The Madam Wang Bin, Ombudsman from the National Health Commission. Su Yueqian, Deputy Director General of the Inspection and Quarantine Division of China Customs Office, and Mr. Su Xiaoming, and Mr. Feng Luzhao, researcher from the Disease Control Center of China. I am the spokesperson, Hu Qiangqiang, from the National Health Commission. First, let me brief to you the updates on the COVID-19 in China. For yesterday, there were 32 new cases. There were 4 imported cases and 28 domestic cases. There is no new deaths. And there were 2 suspected cases, both of which are domestic. We have discharged 4 cases from hospital, and 227 patients were removed of their medical observations. And we still have 4 new severe cases, and there is no suspected cases. And there were, as of yesterday, 864 cases, and according to the latest reports, there were 293 existing cases, and 13 of which are severe cases. And total confirmed cases amounted to 83,000, and we have 7 suspected cases, and we have tracked 750,000 people with close contact, and 5,865 asymptomatic cases were also checked, and
45例，台湾地区446例。6月18日，2省市连续5天以上报告新增本土确诊病例，现有重症病例数连续5天增加。尚在医学观察的密切接触者仍然增长较快，病例救治和
And we still have a quick increase of the people under medical observation, and we still face a tremendous challenge in epidemic control. So we have to do a very good job in cut the spread of the disease. So this is a brief update, and now let's open the floor for questions. So before raising the question, please also introduce yourself. The second lady on the first row, please.
中央广播电视总台央视记者。那么众所周知呢，最近我们
And with CGTN, as is known to all, that the focus of the epidemic control is in Beijing. And so what is the consideration of the Joint Prevention and Control Mechanism organizing the conference at this special time? And also after the guidance was formulated, it has attracted a wide range of attention. And can you brief us the key points of the guidance? And what is the difference between the amended guidance and the previous edition of the guidance? Thank you very much for your question. At present, most of the regions across China are low-risk regions entering summer. The country is reopening its economy, which requires a more targeted epidemic control guidance, and that is why we revised the previous version, which now applies to most of the regions in China, and so now we have 65 different categories of sites. We have added museums, art galleries, gyms, tourist attractions, swimming pools, customs center, and also cinemas, theaters, dancing bars, and other entertainment places. In the meantime, we have supplemented teachers, vendors, and also food-associated professions. So in terms of control measures, we have also added a couple of categories based on different types of workplaces, different groups of people, and for example, we have some new supplementary measures, for example, putting on gloves. So those are the differences. And in terms of the new measures, we reiterate that we have to do a good job in routine hygiene, for example, refresh the air, do very good ventilation, and keep social distancing, and those are some of the measures that we have reiterated over the course of the pandemic. And in this new guideline, we have further affirmed those measures. In the meantime, we have focused on main areas. For example, people working at the agricultural markets, they have to always wear a facial mask and even gloves. And there is also category-based guidance on the public. For example, if you work in transportation means or in entertainment places, if you are a service people there at those places, then you need to wear a facial mask. For other places, if you are able to maintain a social distancing criteria of 1 meter, then you don't need to wear the face mask. And thirdly, we have standardized the use of air conditioners in summer. As we have entered summer, and we use air conditioner at all those places, and traditionally we require the cutoff of wind coming from outside, but right now we have amended those regulations, and we require regular washing and regular ventilation checking of the air conditioning system. And the false difference is that some of the places we still need to take the temperature of people. For example, gaming clubs and internet cafes, and in some particular workplaces such as nurse homes, public institutions, and they need to continue taking people's temperatures, and in addition to doing a good job in hygiene and disinfection. And for banks and other public places, they need to continue to take people's temperatures, and where places are not covered in these guidelines, you can skip this measure. And in gaming clubs and internet cafes and public swimming centers and those indoor areas, and we strongly advise people to cut the time of their staying in those places, and those guidelines is more applicable to summer and in particular to low-risk areas. And I sincerely hope that our media friends can do a good job in covering those new guidelines. Next question, please. Thank you very much. I'm with People's Daily. After the cluster infection in Beijing, there is concern on imported food. There is worry that COVID-19 may be transmitted by imported food, and what efforts have the Customs Office of China done? Mr. Song, please. Thank you very much for your question. The World Health Organization is of the view that based on the investigatory learning of traditional cases, there is no infection caused by imported food, and the FAO and the World Animal Organization both believe that there is very low risk of the COVID-19 being transmitted by food, so it is not recommended that countries need to take actions to restrict the trade of food. China, as the member of the above-mentioned organizations, we maintain a scientific attitude, but out of precaution, since February, China Customs Administration has conducted wide-ranging of efforts in NAT, and in particular, we have tested some of the samples of imported foods, and all of the results show negative. And we also pay close attention to the food safety of imported fish products, and we call on branch offices of China Customs Administration nationwide to do a good job in testing vegetables, imported vegetables, fish produce, and other categories of food imported from overseas. And yesterday, the General Administration of Customs released some data on its websites, and let me offer you some latest data. On June the 18th, the Customs Office of China has tested 15,000 produces imported from overseas, and this includes 1,522 environmental packages, and all of those show a negative results. And in the meantime, we are keeping a close eye on the development of the COVID-19 overseas. In the meantime, we have strengthened collaboration with relevant counterparts. We have written letters to 42 countries requesting them to follow closely the guidelines jointly issued by WHO and FAO, so that they can step up with a sound system in food security and safety, so that we can jointly guarantee food safety. And we have learned that there is a cluster infection in Tunis, in Germany, and immediately after the case, the Chinese Customs Administration was notified of this incident, and we have immediately suspended our imports from that region. And we also made a decision to temporarily take the goods imported from that market, and in the meantime, we have suspended the imports from those enterprises. In the meantime, we are going to continue to do a good job in risk analysis, strengthen our efforts in quarantine and inspection, so that we can do a very good job in food safety. Thank you very much. Next question, please. The journalist is sitting on the very right in the third row, please. Thank you very much. I'm with Economic Daily. To our knowledge, the COVID-19 cases identified this time is mainly because of human-to-human transmission and transmission through droplets, and there is great concern about the food safety on the agriculture market. And so, how serious is the contamination of food? And if after May the 30th, there is still food imported from overseas, can we trust those food? Thank you very much for your question. And so this is a question with a lot of attention in the society. And today's day, we have not identified a single case that COVID-19 can be transmitted from taking in the food. And according to relevant research, the main transmission means of COVID-19 is close contact and through also droplets. And if you are exposed to aerosol contaminated by COVID-19 for a very long time, you can also get infected, and there is no other infection means. But This being said, in order to reduce the risk, we sincerely suggest that when you buy food, do not touch the fresh meat or fresh fish. And when you are cooking food, you need to pay close attention to hygiene and safety of the food. And this includes before and after processing the food. You need to wash your hands. You need to separate the meat with other kitchenwares, and you need to make sure that the food is fully cooked. And when you take fruits, you need to peel off the fruits, peel off the skin. And for kitchenwares, you can steam them for like 15 minutes. And those are the measures that can help us reduce the risk of infection. Thank you very much. Next question, please. The journalist sitting on the very right in the first row, please. Thank you very much. I'm with Xinhua News Agency. In the newly released guideline, we have found that the adjustment of the risk category shows that some of the entertainment places will be suspended, and some of the schools will be delaying their dates of reopening. And how will that affect the society? Thank you very much. As I have introduced that we have mainly targeted the low-risk area for this new amended regulations or guidelines. But in this new version of guideline, we also called for an effective control of the epidemic. Let's see, if one region has been elevated to a medium-risk region from low-risk region, then it has to fully and closely comply with the previous version of the guideline. And deciding whether a region is low risk or medium risk, we have to be based on science, and we have to be flexible. We need to immediately adjust the risk level when there is some new cases. And for example, when the level of the risk has been upgraded, we have to close off entertainment places. And for those places with a large gathering of people, we need to maybe practice social distancing. And at those open door places, and we have to cut human gathering, and we can also keep a social distancing in public transportation centers and hubs. And we need to take people's temperatures, wear official masks, open the window to get some fresh air in. And those are some of the very familiar measures that we have been taking for a number of months. And when the level of risk is adjusted, we can also allow our staff to come into the company at different times, and some of the staff, they can work remotely from home. For some special places, for example, mental hospitals and nursery homes and other places where we host a lot of vulnerable people, we have to practice closed-off management so that there will be no visitors to those places. And for schools, when a region has been upgraded to a medium and high-risk region, the schools cannot be opened. So those are some of the points of attention that I need to reiterate here. Thank you. Next question, please. The second journalist sitting in the second row, please. I'm with Hong Kong China News Agencies. At present, the cinemas and theaters, they have not been resumed. And is there a plan to reopen those places? Thank you very much for your question, and thanks for caring for those places and enterprises. And as you might know, that gaming clubs and theaters and cinemas, they share something in common. They are a closed-door environment. There is insufficient flow of air. In the meantime, people tend to spend a lot of time in those places. So it's highly likely that people get exposed to the COVID-19 for a very long time in those places, and that is why we pay close attention to those places. On May the 7th, there was a document released by the State Council regarding the routine prevention of COVID-19.
实际上已经提到，
This is a document,
条件的这个低风险区要有条件的这个
a working opinion, which stipulates that we can allow some of the
密闭的这个
gaming
这个场所。
gaming clubs and cinemas and theaters to reopen in some regions, but the premise is that you need to do a good job in epidemic control.
它的风险会比一般的
Because, as I have just mentioned, there is a lot more risk in those places than other places.
这是说的这个在低风险区那么开放
So
的
this is
这个
regarding the reopening of those places in low-risk areas.
如果这个
And as Mr. Wang has mentioned, that once a region has been upgraded to a
暂停。
high-risk region, we have to immediately
我在刚刚提到
suspend
关于这个
the operation of those places.
开放的这些要做好重点防护呢，我认为有6
And for theaters and cinemas and gaming clubs opened in low-risk areas, and I think that there are a couple of areas that you need to pay close attention. You have to be
口罩啊、洗手
fully
液啊
prepared in terms of supplies. This includes facial masks,
消毒啊
disinfectants.
那么第二个方面
You
呢
need
是
to make
工作
some
人员要
contingency
做好
plans.
人员的这个
And second,
健康监测
working staff
那么
there,
他们在
they
工
have
作
to be
当中呢要
monitored
的口罩要
in
做好
terms of their health status, and they have to wear a facial mask, and they have to maintain high level of hygiene with their hands. And third, very importantly,
或者是顾客都要
those
进行体温
customers and working staffs entering those places, they have to have their temperatures taken if there is some abnormalities with people's temperature, and then those people cannot enter those places. And the next is that we need to have sufficient ventilation and flow of fresh air, and we have to use the air conditioning system in a very scientific manner. And then number 6, you have to disinfect
或者3D 眼镜啊，或者还有
some of the facilities, and this includes the 3D goggles and the seats.
要尽可能的采用预约制
The last point is also very important, and we encourage customers to reserve before coming to these places so that we can control the overall size of customers entering those places. And also we have to cut the overall exposure time, and according to the latest guideline, it's less than 2 hours. And in the previous versions of the guidelines, and we require people to wear masks
当然我们
and keep a social distancing order. But this time again, we are asking people to
途中
not
要戴
spend
好口罩
more than 2 hours in those places.
1米线
And on top of that, you need to wash your hands very often, keep social distancing of at least 1 meter, and we also encourage contactless payment means in those places. Next question, please. The first journalist sitting in the second row, please.
谢谢。中新社记者，我的问题提给
I'm with China News Agency, and my question is directed to Mr. Song. And at present, so there is still the risk of infection for the staff at the China Customs Administration in practicing testing of food, and what measures have you taken to guard against those risks?
海关一线官员是
Thank you very much for your question, for showing concern
海关
to the
高度重
health
视一
of
线官员的关心
customs personnel, and we are the gatekeeper, and we
前方口岸
provide
实
support
验室
from all those channels, and we try to maintain the safety and security both in the front line and also in the backstage, and we have formulated
对口岸一线
some
不同岗位进行评估
conduct of behaviors, and we have organized some experts to evaluate our efforts, and we also
先后制定
formulate
300
a
个人防护作
safety
业指引
prevention standards to guard against, to reduce work exposure.
实验室检
And
测
we also
以及货物查验岗
have
位
in
官员
place
正确使用防护用品。
we also have in place requirements calling for those relevant people to properly use some facilities while conducting testing efforts. In addition to that, we also organize some targeted trainings through online and offline formats, so that now the training covers all the system, and we also have in place a mechanism to verify the effectiveness of the training. And this includes the handling of the response after exposure and how to guard against COVID-19. And we also have technical support to individuals. And thirdly, we have strengthened our overall monitoring, and we call on relevant people to put on PPE, and we also organize frontier workers to conduct regular testing, and this includes whether the facility is up to the standard and whether there is sufficient stock of facilities, whether we are properly maintaining relevant standards in epidemic control, and whether we are practicing NAT for relevant people. And we also send up delegations to Manzhouli and Huhehaute and to mitigate some of the potential risks. And we follow a people-centered approach. And for those posts, for those frontier posts, we are running several different shifts. And we also researched and developed some new PPEs for the summer environment, and we have in place mental support consulting team so that we can provide some mental support to those people working at the front line. So with all those measures taking place, there is no exposure to the COVID-19 so far from the customs system. Next question, please. I'm with a TV station in Japan. So when the outbreak took place in Wuhan, it was originated from a seafood market, but this time in Beijing, it is also a agriculture market. And why, again, it's a food market? And have you done any analysis on this particular aspect? And will we have another outbreak from a food market? So is there such a possibility? And if there is, what are the prevention measures? Thank you very much. You are correct in that most of the food markets, they have a wet environment, they have a large traffic of people, and once the environment is contaminated, and it's highly likely to break out some epidemic, and there will be a lot of difficulties when such break took place. And for example, the Xinfa agricultural food market is the largest of its kind in Asia, and it's responsible for supplying 80% of the agricultural products in Beijing, and it's also serving Hebei region in general. And since we identified the first case in early June, we have activated the level 2 response measures. We have strengthened community-level management. We have strengthened our management and control on people leaving or coming into Beijing. And we also practice NAT for people who have a contact or exposure to those places. And in the meantime, we call on the public to do a good job in personal hygiene. And after this new outbreak, and the public needs to pay more attention to personal hygiene, and when they go out, they can bring with themselves some disinfectants. They need to pay hygiene in hands, and in particular, when processing food, we need to closely wash our hands, and we need to avoid taking in fresh vegetables or fruits or meat, and we strongly advise the public to follow the newly amended guidelines, which is particularly about the epidemic control in low-risk regions in summer, and this is about the routine epidemic control in some places of low risks, so that we can reduce the chance of people gathering, and when there is people gathering together, we need to practice social distancing of at least 1 meter. And if you have some cases, if you have some symptoms, for example, dry cough or short breath, you have to self-isolate yourself. You have to isolate yourself and avoid going to your workplace, and also avoid taking public transportations. And if you can do all this, we can dramatically reduce the risk. Next question, please. The second journalist in the fifth row, please.
好，谢谢胡司长。中央广播电视总台央广记者提问，我想关注的是
I'm with CGTN. My question is related to centralized air conditioning system, and according to the guideline,
病毒通过通风系统传播的这种风险了，我就想了解一下这个情况。另外呢，针对
you have some measures to guard against the risk of transmitting the virus through the centralized air conditioning system. And according to the guideline, there's also the management on the cooled water in the system. And what is specifically those measures?
谢谢您的提问。那么
Thank you very much for your question.
防护指南专门是针对我们夏季的，因此呢，
And this new guideline is particularly about summer, and air conditioning is one critical part of it.
和上一版的这个指南实际上是增加了。
So there is some difference as compared to the previous version, and we have added
指导意见。应该说这个
a
单纯这个
suggested practice on using centralized air conditioning system.
避免这个病毒通过
Using the centralized air conditioning system alone will not
有这个空间有这个病毒的话，还
cut the spread of the disease. And if there is the virus in that air, using the air conditioning system may still pose a risk. But in order to control the risk, we have particularly come up with 3 countermeasures. The first is that before we use or turn on the air conditioner,
这些设备是否正常，
we have to
然
test
后这个
the status of the facility.
排风口是否保持一定的距
The
离。
air inlet
那么
and
对
outlet
塔呢，要进行
need to
清洗
keep
保持
proper
新风口的
distance,
这个
and for the
这是
consented council, we
第
need
二点呢，
to
在运行的过程当中
regularly
尽量
wash
的这个
the facility, and also
这个减小
we
这个
have
回分
to
这个
increase the inlet of the air and reduce the outlet of
不
the
太现实，所以
air,
我提出
and
的是
it's not realistic to close the outlet. But so that is why
增大这个
we
新风量。
advise
那么
to
三是呢，加强对这个冷却水还有冷
increase
水
the inlet and decrease the outlet.
近期呢，对
We
水
also
温
added
设备和
the
空间
hygiene management on condensed water.
清洗、消毒或者是更换。
It is recommended to regularly wash or refresh the condensed water.
肺炎的这个病例，那么还要对
But
中央
if there is a COVID-19 case in that place, then we
而且
need
是要
to
经
thoroughly disinfect the air conditioning system,
通过以后，
and we also need to conduct a environmental
你也提
test
到关于这个
before we reuse or reactivate the
冷却
air
冷
conditioning.
却水和冷凝水的这个问题。那么这是实际上
As for the condensed water,
空调系统的这个有一些
for
呢
different types of air conditioning, they have different functions, and some of the air conditioners they do not produce condensed water.
它是有一个室外机，然后连接。
For some of the air conditioners, there are a outdoor console joined with a couple of air conditioning sets indoors, and for those type of air conditioners, there is a high produce of condensed water.
冷凝水，主要是这么样的一个情况。 那么在这个过程当中呢，要加强对送风口等设备
So that is why in this process,
消毒
we need
或者是
to
更换。
maintain
那么为什么
hygiene
要
in
其次呢要
some
加强
critical
对
links of the
冷却
facility,
冷却水
and
的卫生管
why
理
we are
主要
managing
是冷凝水主要是
the
产生
cooling water and
空气
condensed water,
处理基础
and the condensed water is
空气
mainly
盘管类的这个
generated from the
标冷盘。
air processing units of the air conditioner.
那么这个如果时间长了呢，会容易滋生微生物，所以的话，
After a long time of
微生物
operation,
会影
it
响
may
室内的空气的质量，或者是一些潜在的风险。所以因
it
此
may
的话
generate
要
some
定期地对冷凝水盘
microorganisms.
清洁。
So that is why we have to regularly clean or disinfectant
谢谢。
the
下一个问题，
condensed water unit.
第
Next
四排
question,
的
please.
这位记者。
谢谢主持人，我是凤凰卫视记者。有民众访纳，
I'm with Phoenix.
出差，离京前呢已经按要求进行了核酸检测，但是到
So there is a report that
被要求医学隔离观察14
person leaving Beijing after conducting the NAT, after arriving at the destination of work trip, he was requested again to do an NAT.
关注到了最近这段
Why
时
is
间呢
that?
北京的这个近期的疫情发生以后，
Thank you very much for your question.
一些政策，
And
针对来
we
自
have
北京中高
learned some
街
of the
乡的
policies in
和
other
包括和新发地市场相关的这些
regions
人
of the
呢， 采
country.
取核酸检测、集中隔离这样的一些措施。大家都
And
知
there
道
are，
6月16号
NAT
北京市
requirements
已
and
经把这个
isolation
疫情
requirements for
机制
people who
从
have
3级调整
visited
到2级
the
那么
Xinfadi
同时还规定
area.
了这个中高
As you have
街
learned
乡的
that
这个
we
中高
have
风险街乡的这个人
upgraded
员
the
和
level
这个
of
新发地市场
response
相关人
from
员呢
level 3 to level 2.
坚持非必要不
And
引进
we also have a
那么确实有需要
management
以
rule
北
that
京的呢
those
进行核酸检测
from the Huaxiang or
针
from
对这样的一些
Xinfadi
情况哈，
region,
我们
they
也
are not
做了
allowed
一些
to
要求
leave
要
Beijing.
加强对于离开北京人员的一些健康管理的服务。那么
So
包括
we have
几方
some
面
requirements
第一呢，就是
to do
要
a
针对
good
5月
job in
30
serving
号到6
their
月16
health
号期
needs.
间
And this
大家都
includes
知道
the
这
following.
个我们这段这个时间的规定呢，还是相对来说有依据的。那么来自
So
这个期
between May
间
the
来自
30th
北京市
to
中高风险的中
June
高
the
风险街乡
13th.
在北京市呢，因为它的区域比较大，北京
So
市的
if you
是
are
按照街
from
乡
the
来
medium
划
and
分
high
为
risk
的。那么对于
areas
这
in
些人员
Beijing,
还有北京地新发市场
I'm
这个相关的
referring
人
to
员
those
各个地方呢
sub-district
要加强追踪管理
administrations in
那么
Beijing,
做到
and
核酸检
if
测，并
you
检进检。
are
对于
from
核
those
酸检
places,
测阳
and
性
then the
还有
relevant
它还有
administration
呢
needs
就
to
是
do a good job
这
in
个阳
tracking
性的
your
人员要进行隔离。对于疑似病例、
whereabouts,
确诊
and
病例、
if
无症
you
状
have
感
been
染者的
tested
密切接触
positive,
密切接触者，这些人员呢，这个如果核酸检测是阴性，要实
or
行
if you
实
have
时
close
实时
contact
集中隔离
with
去
a
观察。
positive
对于
case,
其他的
then you
这
have
个
to
核
be
酸检测阴性
hospitalized,
的人
and
员，
if
单位和
you
社
have
区
a
呢要加强
NAT
健
result
康
of
管理，
negative, but you have
督
a
促
close
他们做
contact,
好
then you
14
have to
天的
be
健康监测和
isolated.
个人的防护。
And
如果出现了
health
一些发热啊、
organizations
咳嗽
in
这
relevant
些症状，
regions
要
need
及时
to
就医。
guarantee that those
第二
with
方面呢，就是
symptoms
针
of
对
dry
6月
cough or
16 号
short
以
breath
后，
needs to be
只有离
observed
境前7日内核酸检测
from a
阴性
medical
证明，
perspective. And
或者是
also
说能够
after
出
June
示
the
包括
15th,
核酸
if
检
you
测
hold
阴
a
性证明的
certificate
健康码，
of
也就是说
NAT
这个码
result
如果是
within
绿
7
码的话
days,
这样的离京人员在到达
or
目的
you,
地
if
以
you
后呢，
hold
在
a
体
green
温测
health
量
code,
正常，并且做好个人防护的这样的前提下呢，是可以自由的、有序的流动的。那么各个
you
地
are
方
allowed
不
to
应该
leave
再针对
Beijing,
这样
and
的人员呢出台一
you
些
can
或者
conduct
是
the
设立
business
一些
trips,
限制
and
性的措施。
no
第
place
三方面呢，
in
就是
China
针对
should
没有这个针对一些
set
因
some
特殊
additional
情况
restrictions
在离开
on
北京之
those
前呢，没有
group
来得
of
及
people.
进行核酸检测，这样的一些离京人
And
员
also
到
another
达目的
scenario
地
is
之后
that
呢，应该进
those
行核酸
who
检测。
haven't
如果核
conducted
酸检测
a
阴性，那么
NAT
要进行正常的
before
体温
leaving
测
Beijing,
量
and then
做好个人
after
防护
arriving at their
可以进
destination, they have to conduct a
那么这样的一些
NAT.
措施呢，
And
我
they
们
also
希
need
望各个
to
地方呢能够遵照
do a good job in personal protection, and
谢谢。
so I hope that those are some of the
最后一个问题。
guiding points that can be followed. All right, next question, please. The last question. I'm with the Cross Strait Times from Singapore. So a lot of the people say that the virus can live for a very long time in a low temperature environment or on a hot surface. A lot of the food enterprises, they keep the food in a very low temperature environment. And will that be changed in the future? Let me direct this question to Wang Bin, and maybe there are some follow-up response from other guests. Thank you very much for your question, and I can tell you it's very important to keep our food in a low environment, in a low temperature environment in summer, and this is a very important measure, and as shared by other experts, the risk of transmitting through food is almost impossible, and we have to focus our attention and measures on regular epidemic control, and we cover hotels and seafood markets and agricultural markets. We have very strict requirements, and in the meantime, we require relevant localities to strengthen their risk monitoring on food imported from overseas, and we also require them to conduct sample tests, irregular sample tests in those places, and this also includes food that is frozen. And different localities in China have to focus on agriculture markets, and they have to encourage vendors and merchants to conduct thorough disinfection in their environments and in those agricultural markets, and in particular those frozen food market, they have to do a good job in disinfection, and this includes the sewage system and also the garbage center and also their operating table, and it also includes the freezing cargo or trailer trucks, and for warehouses that keep those food, and we need to disinfect the packages, and at those agriculture markets, we need to have in place a real name-based management practice. So I believe that as long as we step up with regular control measures, we will be able to have very effective results. Mr. Feng, do you have any follow-up? No. All right. Thank you very much to all the journalists, to all the guests. This is the end of today's release. Thank you very much.